Are brainstem auditory evoked potentials BAEP used in misdiagnosis? Imagine trying to listen to a sound and having your brain respond in a way that shows how well your nerve pathways are working. That's what brainstem auditory evoked potentials, or BAEP, do. They measure the electrical responses generated by the auditory pathways in the brainstem when sound is played through headphones. These responses can tell doctors if there's any disruption along these pathways, which can happen in multiple sclerosis. Multiple sclerosis is a disease where the immune system attacks the protective covering of nerve fibers in the central nervous system. This damage can happen anywhere, including the brainstem, which is a crucial area connecting the brain to the spinal cord. Because MS can cause demyelination or damage to nerve fibers in the brainstem, BAEP tests can pick up abnormalities in how the nerves conduct signals. If the conduction is slowed or irregular, it might suggest that the brainstem is affected by MS. Doctors often use BAEP as part of a broader set of tests when diagnosing MS. They also rely on visual evoked potentials, which measure how well the optic nerve responds to visual stimuli, because optic nerve involvement is common in MS. BAEP can be especially helpful because they can detect issues in the auditory pathways that might not yet cause noticeable symptoms. This makes them useful for early detection of nerve damage. Research shows that abnormalities in BAEP are found in many people with MS and can be linked to symptoms related to brainstem dysfunction. These tests can also help predict how much disability a person might experience, providing valuable information for managing the disease. However, it's important to remember that BAEP results are not definitive on their own. Some people with MS may have normal BAEP tests, even if they have brainstem lesions visible on MRI scans. Conversely, some abnormalities might be present without clear symptoms. The advantage of BAEP is that the test is painless, non-invasive, and quick to perform. It can be done in a clinical setting in just a short time, making it a convenient tool for doctors. Because they can detect nerve pathway damage before symptoms appear, BAEP tests are especially helpful in early diagnosis or when MRI results are inconclusive. In clinical practice, BAEP is used alongside other evoked potentials and MRI scans to build a complete picture of the disease. Visual evoked potentials tend to be more sensitive for detecting MS, especially because optic nerve issues are common, but BAEP adds valuable information about brainstem health. In summary, BAEP tests assess the electrical activity in the auditory pathways of the brainstem. They can reveal abnormalities caused by MS lesions, supporting diagnosis and helping to understand the extent of neurological involvement. While they are not used alone to diagnose MS, they are an important part of the overall assessment. They help identify nerve damage early, even before symptoms develop, and provide objective evidence of central nervous system demyelination. Always consult healthcare professionals for personalized diagnosis and treatment options, as MS can vary greatly from person to person.